Hi, everyone. My name is Krithika Suresh, and I'm a research assistant professor in the Department of Biostatistics and Informatics here at the Colorado School of Public Health. I'm here to give a quick overview of some of my research in personalized medicine. So taking a step back first, what exactly is biostatistics? So like others in public health, our work is driven by questions in health research, such as assessing whether there is a benefit to a new treatment or identifying predictors of a health outcome. And our role as biostatisticians is to turn data into knowledge to help answer these questions. So we help design studies to collect the necessary data, we analyze the data using appropriate statistical methods, and we interpret and report results in a way that is meaningful to collaborators. So the particular question that sparked my research was posed by a radiation oncologist working with prostate cancer patients. And they wanted to know for a particular patient, what is the probability that they'd be alive 5 years from now, given their individual characteristics and medical history? So this question is usually asked when the patient is in the doctor's office at some baseline time, which in our case was time of treatment. And at that time, the doctor knows some information about the patient. So their age at diagnosis, their cancer stage, if they have any comorbidities. And a traditional prediction model uses only this information to then predict the patient's survival probability. But with improving technologies and treatments, patients are living longer and we continue to follow them beyond treatment. So 2 years later, this patient comes back into the doctor's office and the doctor still wants to answer this question, but now 2 years post-treatment. And during that time, things may have changed with the patient. So in addition to baseline covariates, we also collect information on covariates that can change over time. So these can be biological markers such as blood pressure or whether the patient has experienced an intermediate event. And we want to incorporate this up-to-date patient information to make a more accurate dynamic prediction. So in our application, the time-dependent information was an indicator of whether the patient experienced metastatic clinical failure. So at time 0 or baseline, the patient does not have clinical failure, but for this patient, they experience it about 1 year later. So at 2 years, when we update their survival prediction, we want to incorporate that information. So to answer our question, we conducted a retrospective study where we collected data on 745 men diagnosed with prostate cancer and treated with radiation therapy. These patients were then followed from time of treatment until time of death or loss to follow-up. And the patients have baseline information, but they also have multiple visit data, at which time we learned 2 important pieces of information. 1, that they're still alive at that time, and 2, whether they have experienced metastatic clinical failure up to that point. So once we have our data, the statistical task is to develop a tool that incorporates the time-dependent information to produce dynamic predictions during follow-up. And then we also want to then evaluate the performance of the tool. And finally, we want to be able to apply it to obtain a prediction for a new patient. So we develop a mathematical model for dynamic prediction. We model the time-dependent variable and the survival data separately, and we glue together the 2 models using something called a copula, which gives us a joint model from which we can then compute our dynamic predictions. So we can then apply this model to a new patient. So from their baseline characteristics, this patient is fairly low risk, and during their follow-up at about 1 year, we find that they experience metastatic clinical failure. So here we present the predicted 5-year survival probabilities for the patient during their post-treatment follow-up. In blue, we have the predictions from a traditional model that uses only their baseline covariate information. And in orange, we show the prediction from our developed dynamic prediction model. So from baseline to about 1 year, the patient has a very high probability of surviving the next 5 years, close to 100%. And then after the experienced clinical failure at 1 year, our model takes this information into account and their predicted survival probability drops to about 12%. While the model in blue that does not dynamically incorporate this information greatly underestimates the patient's risk. So the clinician can then use this information to make patient-specific decisions. So when they update the prediction after 1 year and see the low survival probability, they may decide to implement additional therapies or follow up with the patient more frequently. So this particular work falls into 2 main areas of statistics: survival analysis, because we're studying a time to event outcome, and predictive modeling, because our question of interest is to predict an outcome probability. But biostatistics encompasses a broad range of statistical methods research and areas of application. And these are just some of the other areas of very interesting research going on in our department. So thank you and hope you have a great rest of your visit day.